Thank you for joining us. I'd like to welcome you to this webinar to introduce you to the new Title IV-E Prevention Services Clearinghouse Standards and Procedures. My name is Christine Fortunato, and I am the Child Welfare Research Team Lead at the Office of Planning, Research, and Evaluation with the Administration for Children and Families within the U.S. Department of Health and Human Services. As many of you know, ACF established the Prevention Services Clearinghouse to perform systematic reviews of research and evaluation on programs and services intended to provide enhanced support to children and families and prevent foster care placements. The Prevention Services Clearinghouse was developed in accordance with the Family First Prevention Services Act of 2018. The Clearinghouse reviews and rates programs and services as promising, supported, and well-supported practices. These practices include mental health prevention and treatment services, substance abuse prevention and treatment services, and in-home parent skill-based programs, as well as kinship navigator programs. On June 22, 2018, ACF published a Federal Register notice requesting public comment on initial criteria for selecting, reviewing, and rating programs and services, and potential programs and services to be considered for systematic review. Commenters included state and local administrators, program and service developers, foundations, nonprofit organizations, tribes, researchers and evaluators, and other stakeholders. The Prevention Services Clearinghouse systematic review process was informed by these comments and by the review processes used by other prominent evidence clearinghouses, including the Institute of Education Sciences What Works Clearinghouse, the Administration for Children and Families Home Visiting Evidence of Effectiveness Review, and the California Evidence-Based Clearinghouse for Child Welfare. On November 30th, 2018, the Children's Bureau released a program instruction on the requirements state Title IV-E agencies must meet when electing the Title IV-E prevention program. Attachment C of the program instruction included revised initial criteria for selecting, reviewing, and rating programs and services, as well as the first list of programs and services selected for review by the Prevention Services Clearinghouse. In September 2018, ACF awarded APT Associates the contract to establish and maintain the Prevention Services Clearinghouse. The objectives of the Prevention Services Clearinghouse are to conduct an ongoing, transparent, comprehensive, and systematic evidence review of studies on candidate programs and services, synthesize and disseminate the results of the ongoing evidence reviews, and establish, maintain, and update an interactive and searchable website. We're excited to release the Prevention Services Clearinghouse Handbook, Standards and Procedures on Friday, April 26th. The handbook provides a detailed description of the standards used to identify and review programs and services for the Prevention Services Clearinghouse. Today, members from the app project team will walk you through the standards and procedures included in the handbook. We hope that the information we discuss today will help you in your own work. ACF's goal has been and remains to establish the clearinghouse and to review and rate as many services and programs as quickly as possible to support states' efforts to improve outcomes of children and families. With that, I'll turn it over to the app project team members, Sandra Wilson, Sue Kearns, and Erin Baumgartner. Thank you.
Thank you, Christine. And thank all of you for joining us today. We have a big crowd. My name is Sandra Wilson, and I am a principal associate with APT Associates, and I'm also the project director for the Prevention Services Clearinghouse. I'll be presenting today, and my co-presenters are Erin Baumgartner and Sue Kearns. Erin is an associate at APT Associates and is our deputy project director. Sue is a research associate professor at the University of Denver Graduate School of Social Work. She's also the principal investigator for the Clearinghouse. The three of us together will be presenting today. Before we get started with the content, we have some housekeeping to attend to. We encourage you to submit questions throughout the webinar using the chat tool. To activate the chat window, if you hover your mouse over the slides on the screen, a series of circles will appear on the bottom. If you click on the talk bubble, a chat window will appear on the right side of your screen. For many of you, this may already be visible, but if you don't see it, hover and click on the talk symbol. When you're submitting a chat, please put all panelists in the to box so that all of the presenters today can see your question. And then you type in your question and hit enter. You can ask a question whenever it comes to mind. You don't have to wait until the question and answer session at the end. Because we're recording this webinar, every member of the audience is in listen-only mode. That improves the sound quality of the recording, but it also means that the only way for you to ask questions is through the chat tool. If we don't make it through all your questions today, you'll be able to find answers to many of your questions on the FAQ section of the website that will be launched soon. Additionally, all of the information we are presenting today is available in the handbook. We recommend that you access the handbook on the ACF website for additional details. So with that introduction, let's get started, and I'm going to turn things over to my colleague, Sue Kearns, for our first segment today. Sue?
Thank you, Sandra. In the webinar today, we will introduce the standards and procedures that the Prevention Services Clearinghouse uses to carry out the systematic evidence review and to rate programs and services. We will describe the entire process from start to finish, beginning with how programs and services are identified for review, and ending with how the well-supported, supported, promising, and does not currently meet criteria ratings are determined. This review process is outlined in detail in the Prevention Services Clearinghouse Handbook of Standards and Procedures, which was released on April 26th. We will also provide the timeline for the website launch and future updates, but we will not be sharing program and service ratings today. At the end of the webinar, we will have a few minutes for question and answer. Please remember to submit your questions through the chat section of your webinar screen. As Christine mentioned, ACF established the Prevention Services Clearinghouse to be an objective and transparent source of information on evidence-based programs and services that may be eligible for funding under the Title 4E of the Social Security Act, as amended by the Family First Prevention Services Act of 2018. The Handbook of Standards and Procedures details the systematic review process we use to identify and rate studies, and ultimately to provide ratings of programs and services as either well-supported, supported, promising, or does not currently meet criteria. This handbook was created in collaboration with many stakeholders and experts, including content experts, research methodologists, representatives from other evidence reviews like the CEBC and HOMV, and our federal staff. As is the case with evidence reviews more generally, we anticipate making periodic updates to the handbook in the future. The handbook is available now on the ACF website. Today we'll be walking through this infographic, which provides a high-level overview of the 6 steps we follow to identify and rate programs and services for the Prevention Services Clearinghouse. If you'd like to come back to this infographic, you can also find it in the handbook online. All programs and services that we review go through the same process, and each step in the process is carefully documented by our staff. We use the systematic review process in order to remain objective about the program and services that we review and to be transparent about all aspects of the review. We're now going to go through each of these 6 steps. The first step is to identify programs and services for review. This information is covered in Chapter 1 of the handbook. As previously mentioned, the program instruction released on November 30th, 2018 included the first list of programs and services selected for systematic review. We know that many of you are curious about how we identified and selected the first list of programs and services for review. And this first list of programs and services met at least 2 of the following conditions. They were either recommended by state or local government administrators in response to the Federal Register notice. They were rated by the California Evidence-Based Clearinghouse. They were evaluated by Title 4E Child Welfare Waiver demonstrations. They were the recipients of a Family Connection discretionary grant. and/or they were recommended by federal partners. Going forward, candidate programs and services will again be identified using an inclusive process that incorporates feedback from many of you. Only some of these programs and services identified will be selected and prioritized for review. We will identify these additional programs and services for potential review from sources, including the recommendations that were received in response to the 2018 Federal Register Notice, and public call for program and service recommendations, which will occur at least annually. Also, the Prevention Services Clearinghouse may use an environmental scan or an inventory of the literature to identify additional programs or services. Particular consideration will be given to programs and services recommended by state or local government administrators and tribes, rated by other clearinghouses, such as the CEBC or HOME-V, recommendations by federal partners, and/or those that are evaluated as part of any grant supported by the Children's Bureau, such as the Title IV-E Child Welfare Waiver Demonstrations or Regional Partnership Grants. Step 2 in the process involves selecting and prioritizing programs and services for review that were identified from the sources we just discussed. This step is covered in Chapter 2 of the Handbook. For each candidate program or service, our staff determines whether it's eligible to be reviewed based on the requirements of the Family First Prevention Services Act as codified in the Title IV-E of the Social Security Act. Title IV-E of the Social Security Act describes 4 program or service areas: mental health prevention and treatment programs or services, substance abuse prevention and treatment programs or services, in-home parent skill-based programs or services, and kinship navigator programs. Programs and services may be eligible for review in more than one of these program or service areas. To be eligible, programs and services must also be clearly defined and replicable. To meet this criterion, programs and services must have available written protocols, manuals, or other documentation that describes how to implement or administer the practice. Next, because many programs and services could be eligible for review, they are prioritized for review. Programs and services are prioritized for review if they target outcomes in the domains of child safety, child permanency, child well-being, or adult well-being. Programs and services in the area of kinship navigator must have target outcomes in these domains, as well as access to services, referral to services, and/or satisfaction with programs or services. We'll talk more about how we define these target outcomes shortly. The Prevention Services Clearinghouse also prioritizes programs or services that are in active use and for which there are implementation and fidelity supports available in addition to the manual. The Prevention Services Clearinghouse prioritizes programs and services in a way that ensures representation across the 4 program or service areas. The number of programs and services up for review at any given time is determined based on available resources. Step 3 involves a comprehensive literature search. This information is covered in Chapter 3 of the Handbook. Once a program or service is prioritized for review, the next step is to identify the studies that will be used to determine the program or service rating. Studies are located from a wide range of sources, including looking at other publicly available evidence reviews and registries, and comprehensive literature searches. The Clearinghouse also scans the websites of federal, state, foundation, and private agencies who sponsor or conduct relevant research. Clearinghouse staff organize and document all of the search results, which are then assigned to screeners for eligibility screening. In Step 4, the results of our comprehensive literature search are screened for eligibility, and the eligible studies are prioritized for review. This information is covered in Chapter 4 of the Handbook. Next slide. Thank you. Each study identified in the search is then screened by 2 trained staff. To be eligible for review for the Prevention Services Clearinghouse, studies must meet 5 eligibility criteria. First, studies must be published or prepared in or after 1990. Second, studies must be publicly available and published in peer-reviewed journals or research reports. Dissertations, theses, and conference papers are not eligible. Third, studies must be available in English. Fourth, studies must use a randomized or quasi-experimental group design with at least one intervention condition and at least one comparison condition. Comparison groups must be no or minimal intervention or treatment as usual groups. Fifth, studies must measure and report program or service impacts on at least one eligible target outcome. We engaged in a process to solicit extensive expert input in how to operationalize the indicators and domains for each of the target outcomes. For a study to be eligible, it must assess one or more eligible target outcomes. It may assess additional outcomes, but only those listed in the next 3 slides will be evaluated by the Clearinghouse. So for child safety, this includes reporting of substantiated or unsubstantiated child abuse and neglect. It may also include injuries or ingestions as reported by healthcare providers, or measures that assess neglectful, psychologically aggressive, or abusive parenting behaviors. For child permanency, this includes measures of placement stability, such as the length of out-of-home placement, placement disruptions, the stability or permanency of placements, and reunification. Indicators may be from administrative or non-administrative sources. Child well-being is a multifaceted domain that broadly refers to the skills and capabilities that enable young people to understand and navigate their world in healthy, positive ways. The Prevention Services Clearinghouse reviews a number of child well-being domains, including behavioral and emotional functioning, social functioning, cognitive functions and abilities, educational achievement and attainment, physical development and health, substance use, and delinquent behavior. Adult well-being is a multifaceted domain that broadly refers to the specific skills and capabilities adults need to navigate their world and provide for themselves and their children's needs. The Clearinghouse reviews several adult well-being domains, including parenting practices, the parent or caregiver's mental, emotional health, substance use, criminal behavior, physical health, or the economic and housing stability of the family. For Kinship Navigator programs only, 3 additional outcomes are also eligible, along with the outcomes I discussed on the previous 2 slides. These Kinship Navigator specific outcomes include access to services, referral to services, and satisfaction with programs and services. Access to services refers to a parent, caregiver, or family's knowledge of services, ability to access these services, or the utilization of services that support the family. It can include financial, legal, social, educational, and health and mental health services. Referral to services includes referrals to any needed service, and satisfaction refers to a parent or caregiver's satisfaction with any programs or services to which they are referred or which they receive as part of a Kinship Navigator program. When multiple formal versions of a program or service are available, the Prevention Services Clearinghouse selects just one version for review at a time and reviews eligible studies only of the version selected. Other versions of a program may be eligible for review as separate programs or services. Multiple formal versions may be reviewed for the Prevention Services Clearinghouse in the same round of review or in later rounds of review. Programs or services may not be substantially modified or adapted from the manual or version of the program or service selected for review. Adaptations are modifications to content, such as adding new component to an established program or service or subtracting components that are part of the manual, or adaptations or modifications to the modality, such as changing from in-person to online, are not eligible for review but may be eligible themselves for review as a separate program or service. Adaptations or modifications to processes may be eligible for review. Reviewers document all adaptations that are reported in studies when screening them for eligibility. These circumstances could include modest shortening or lengthening of treatment session duration, delivering the intervention in-home rather than in a clinic, modifications to enhance the cultural relevancy and/or delivery of the intervention by slightly different professionals. So, for example, using social workers instead of counselors to deliver a program. Senior content experts on the Prevention Services Clearinghouse staff will be consulted to develop a final and documented decision on whether a particular adaptation is acceptable or not. More information about program or service adaptations can be found in the handbook, including specific examples. Some programs or services have been around for a long time and may have a large number of eligible studies available for review. If a program or service has less than 15 eligible studies, all studies are reviewed using the standards to assess how studies were designed and executed, which we'll be referring to as design and execution standards. All studies will also be assessed for risk of harm. In the case that there are more than 15 studies, a study prioritization strategy is used. Points are assigned to each potential study based on design, sample size, duration of sustained effects, the number of outcome domains examined, and if they pre-registered the design or have published study protocol. The first 15 studies will be examined to provide the study rating. If, after review of 15 eligible studies, a program or service has not received a rating of well-supported, additional studies will continue to be reviewed in order until the program or service has achieved a rating of well-supported or all eligible studies have been reviewed. Remaining studies will only be screened for evidence of risk for harm. We'll talk about the design and execution standards and how we assess risk for harm a little later in the webinar. As I just mentioned, programs and services with more than 15 eligible studies, a point system will be used to determine the order of studies reviewed. Reviewers assign points to the studies as follows. First, points are assigned for design. 3 points are given to a randomized controlled trial and 2 points for quasi-experimental designs. Next, points are assigned for sample size. 1 point for studies with a total sample size of 250 or more participants. Then, points are assigned for the duration of sustained effects examined. 2 points are given to studies with sustained effects of 12 months or more, and 1 point is given to studies with sustained effects between 6 and 12 months. Then, points are assigned for the number of different outcome domains examined. 1 point is given for each outcome domain that's examined in the study, so there's a maximum of 3 points for child safety, permanency, child well-being, or adult well-being. And finally, points are assigned for pre-registered study designs. 3 points are given to studies that were pre-registered in a trial registry such as clinicaltrials.gov or that have published study protocols. Points are then totaled for each study. The maximum number of points is 12. Studies are then sorted by total point and reviewed in that order. The fifth step in the review process is where we evaluate the credibility of available evidence on selected programs and services. This information is covered in Chapter 5 of the Handbook. To tell you more about the evidence review, I'll turn the session over to Sandra.
Thank you, Sue. This is Sandra again, and we're now going to turn to the design and execution standards developed by our team for the Clearinghouse. Every eligible prioritized study is reviewed by 2 trained reviewers on our staff using the design and execution standards. Sue mentioned earlier that all studies are also assessed for risk of harm. We'll discuss how we do that a little bit later in the webinar. The design and execution standards focus on the internal or causal validity of the research. That is whether the study design and the procedures used by the study authors, that is how the authors execute the design, whether that produces credible evidence about the causal impact of the intervention on the outcomes. When we apply the design and execution standards to the eligible research studies we review, the result is one of three ratings. First, studies with a high supportive causal evidence rating meet our highest standards for credible evidence. Second, studies with a moderate supportive causal evidence rating are still rigorous, high-quality studies that produce credible evidence. They don't receive the highest rating because not all threats to the internal validity of the study can be ruled out. The third rating is for studies with low support of causal evidence. These studies do not produce credible evidence for the Prevention Services Clearinghouse and are not used to determine the program and service ratings of well-supported, supported, and promising. As a reminder, randomized designs, including cluster randomized designs and quasi-experimental designs, are eligible for review. However, only randomized designs with low attrition can achieve the highest rating because these designs produce the most credible evidence. Most of the design and execution standards are operationalized differently for each type of design, but some standards are applied in the same way to both randomized controlled trials and quasi-experimental designs. All group designs, both randomized controlled trials, which are noted as RCTs on the slide, and quasi-experimental designs, which we call QEDs, must meet a few general requirements. You can read more about these general requirements in the handbook, but I'll explain each one of them here. Reviewers look for confounding factors that make it difficult to attribute an observed intervention effect to the intervention. For example, a confound can exist when an intervention is delivered by a single therapist. In a case like this, you cannot determine whether any positive effect you observe is due to the intervention or due to the skills of the therapist. Studies with confounds receive a low rating. In addition, reviewers evaluate whether missing data, if any, was addressed using methods that limit the potential bias. Our missing data standards parallel those used by the Department of Education's What Works Clearinghouse and are described in detail in the handbook. Reviewers also assess whether each outcome measure is reliable and has face validity. Each outcome measure must also be administered consistently. To satisfy the criterion for face validity, there must be a sufficient description of the measure in the study for the reviewer to determine that the measure is clearly defined, has a direct interpretation, and measures the construct it was designed to measure. Reliability standards apply to all measures as well, and a variety of different reliability statistics are acceptable. You can read more about that in the handbook. In addition, all measures must be administered the same way for both the intervention and comparison groups in a study. Finally, reviewers evaluate the statistical models used to estimate the impacts of the interventions to ensure that the impacts we reported on the Clearinghouse website are valid estimates of the intervention's impacts. For randomized studies that meet the general requirements I just described, reviewers follow a flowchart like this one to determine the rating. A reviewer's first task is to evaluate the integrity of the randomization itself. This involves assessing whether situations occurred in which participants switched conditions after assignment, or if some participants were put into the intervention or comparison group outside of the randomization procedure. For cluster randomized studies, such as when clinics are assigned to intervention and comparison conditions rather than individuals, reviewers evaluate whether and how individuals can join those clusters. If the integrity of randomization is compromised, reviewers use the quasi-experimental standards to finish reviewing a study. If the integrity of the randomization is confirmed, reviewers assess overall attrition from the sample, as well as the differential attrition in the intervention and comparison conditions. Attrition can bias the estimates of the intervention effect obtained from randomized studies, which is why we evaluate it. Overall attrition is the overall percent attrition from the entire sample. Differential attrition is the difference in the attrition rates between the intervention and comparison groups. We have set a threshold for the amount of attrition that is tolerated, and that is based on the thresholds used by the Home Visiting Evidence of Effectiveness Review and the What Works Clearinghouse. If either the overall or differential attrition is high in a study, reviewers use the quasi-experimental standards to finish reviewing the study. Even if attrition is low, reviewers examine the baseline equivalence of the intervention and comparison groups. That is, reviewers evaluate how similar the groups are at the baseline or at the beginning of the study. If the groups are equivalent, or if the study authors control for baseline covariates when estimating the impact of the intervention, the study can receive the highest rating. If the groups are found not equivalent and the study authors do not control for baseline covariates, the study receives a moderate rating. Recall that these are low attrition RCTs, the gold standard of research studies. If randomization is not compromised and attrition is low, the worst rating a study can receive is moderate to reflect the high internal validity that results from the randomization. When establishing baseline equivalence, reviewers most often examine the pretest, which is a direct pre-intervention measure of the outcome. This may not be feasible for all studies. For example, an executive function outcome for 3-year-olds may not be feasible to administer as a pretest with much younger children. When pretests are not feasible, reviewers, with the help of our content experts, look for alternatives that are in the same or a similar domain as the outcome. And in some cases, reviewers may also use sociodemographic characteristics to establish baseline equivalence. Reviewers use this flowchart to evaluate quasi-experimental designs. You can see that these designs are not eligible to receive a high rating. Studies that use quasi-experimental designs can only be considered for moderate or low ratings. Reviewers also use this flowchart if they are reviewing a randomized controlled trial for which the randomization was determined to be compromised, or a randomized controlled trial which exhibits high overall or differential attrition. Remember also that all the general requirements I mentioned earlier must be met for all studies, regardless of design. These include looking for confounding factors, assessing how missing data are handled, examining the quality of and consistency of measures, and examining the appropriateness of the statistical models. If the general requirements are met for a quasi-experimental study or a high attrition or compromised randomized controlled trial, then baseline equivalence is assessed. Baseline equivalence for quasi-experimental studies is assessed using the same procedures as for randomized studies. Reviewers first look for direct pretests on the outcomes, and if these are not feasible, they use pretest alternatives or sociodemographic characteristics for baseline equivalence. You can read more about how we conduct the baseline equivalence assessment in Chapter 5 of the Handbook. Now, I've gone over the design and execution standards at a very general level to give you a sense of what aspects of study quality we assess when we review studies for the Clearinghouse. The Handbook provides a much more detailed description of each design and execution standard, how it is assessed or calculated, and what reviewers need to look for in the studies to make their determinations. In some cases, the studies we're reviewing do not provide all the information we need to evaluate each standard. In these cases, we write to study authors and ask them to provide the information we need to complete the review. If we do not have or are unable to get the information we need, studies receive a low rating. I'm now going to turn the webinar over to Erin, who will review how we go from these individual study ratings to the overall program and service ratings you will see on the website. Erin? Erin might be muted, in which case I will continue until she's not. So the first step in the final step in the Prevention Services Clearinghouse review process involves assigning program and service ratings. This information is covered in Chapter 6 of our handbook. Once all of the eligible studies that support the evidence base for a program or service are assessed, the program or service receives a rating. In accordance with the Family First Prevention Services Act, programs or services can receive one of 4 designations. These are well supported, supported, promising, and does not currently meet criteria. Next, I'll provide some more information about each of these ratings. However, please remember that more information can be found in the handbook that's available online. The first possible rating is well supported. And in accordance with the Family First Prevention Services Act, those programs or services that receive a well supported designation will be those that have at least 2 studies with non-overlapping samples where both studies were delivered in usual care settings and both studies had high or moderate ratings on design and execution. There must be favorable effects found for at least 1 target outcome on each of the 2 studies, and at least one of the studies must show that there is a sustained favorable effect lasting at least 12 months beyond the end of treatment. In accordance with the Family First Prevention Services Act, a program or service cannot be rated as well supported if there is sufficient evidence of risk of harm such that the overall weight of the evidence does not support the benefits of the program or service. To assess this, the Prevention Services Clearinghouse looks for the presence of a statistically significant unfavorable effect on both target and non-target outcomes. The second possible rating is supported. According to the Family First Prevention Services Act, those programs and services that receive a supported designation will have at least 1 study that is high or moderate on design and execution, that is carried out in a usual care setting, and where sustained favorable effects are demonstrated for at least 6 months beyond the end of treatment. Again, a program or service cannot be rated as supported if there is sufficient evidence of risk of harm. The third possible rating, back 1 more, please. Thank you. The third possible rating is promising. According to the Family First Prevention Services Act, those programs or services that receive a promising designation will have at least 1 study that has a high or moderate rating on design and execution and has a favorable effect on at least 1 target outcome. Here again, a program or service cannot be rated as promising if there is risk of harm. The fourth and final rating is does not currently meet criteria. In some instances, there may be no studies of the program or service that receive a moderate or high design and execution rating. In other instances, there may be studies with moderate or high design and execution ratings, but they do not exhibit any statistically significant effects on the target outcome. These programs in both of these scenarios will be rated as does not currently meet criteria. If there is sufficient evidence of risk of harm, the program may be deemed does not currently meet criteria by the Prevention Services Clearinghouse. Risk of harm is determined if there is an empirical basis as evidenced by the presence of unfavorable effects on target or non-target outcomes that suggest that the overall weight of evidence does not support the benefits of the program. Now, let's unpack what we mean by favorable effects, sustained favorable effects beyond the end of treatment, and usual care and practice settings. Okay. For all studies that receive high or moderate ratings, reviewers record or compute impact estimates in the form of effect sizes for each outcome. The effect size is an index of the magnitude of the effect of the intervention on a given outcome. To ensure consistency across studies, the effect sizes for each outcome are independently computed by clearinghouse raters. Statistically significant findings can be in either a favorable or an unfavorable direction. The clearinghouse will indicate the direction of findings. Favorable impacts are statistically significant in the desired direction, and unfavorable impacts are statistically significant and not in the desired direction. So how does the clearinghouse determine risk of harm? According to the Family First Prevention Services Act, the clearinghouse will determine whether there is risk of harm for all programs and services that we review. The clearinghouse will document all statistically significant unfavorable impacts on any outcome, whether an eligible target outcome or not, from any studies receiving high or moderate design and execution ratings. If there is sufficient evidence of risk of harm such that the overall weight of evidence does not support the benefits of the program or service, the program may be rated as does not currently meet criteria. Additionally, programs or services may not be designated as well supported, supported, or promising if case data suggests that a risk of harm that was probably caused by the treatment was severe or frequent. What are usual care and practice settings? According to the Family First Prevention Services Act, to receive a supported or well-supported rating, the favorable evidence for a program or service must come from research conducted in a usual care or practice setting. Usual care and practice settings are existing service agencies or providers who deliver mental health services, substance abuse prevention and treatment services, in-home parent skill-based programs, or kinship navigator programs. Usual care settings may use routine personnel who already work for the agency, or they may employ outside staff, such as researchers or graduate students, if the services themselves are those that are typically delivered by staff at that agency in the absence of the research study. According to the Family First Prevention Services Act, to receive a rating of well-supported, a program or service must have a sustained favorable impact on at least one target outcome 12 months after the end of treatment. To receive a supported rating, a sustained favorable impact must be demonstrated at least 6 months after the end of treatment. Defining the end of treatment can be difficult, but it is important that we have a standard definition because this differentiates those programs and services that are eligible for the well-supported and supported designations. Therefore, the end of treatment is defined first as the stated end of treatment by the study or program or service documentation. However, it may be the case that this is not clear, especially for those programs and services where treatment extends indefinitely or varies across participants, or if services are staggered. When this is the case, we select a time point that corresponds to when the majority of a clearly defined set of services were stated to have been delivered, If that information is not available, but studies provide information about the average or range of service delivery, reviewers will use the longest program duration or estimate it from the data provided as the end of treatment and determine the length of follow-up from that point. Now that we've reviewed all the standards and procedures for determining program and service ratings, we want to tell you a little bit about the Prevention Services Clearinghouse team and how they're supported throughout the reviewing process. The overall team consists of federal staff, contractors, subcontractors, consultants, stakeholders, and experts. All of these team members help shape the handbook. To execute the reviews, we have a team that is currently composed of 24 trained reviewers, most of whom are experienced reviewers with the What Works Clearinghouse. These reviewers have all received in-depth training on the Prevention Services Clearinghouse standards. They also participate in our office hours that are offered twice weekly to address questions and concerns related to specific studies. In addition, senior staff and content experts are available to the reviewers at any point throughout their review process to field questions. Now we'd like to share a little more information about what to expect on the Prevention Services Clearinghouse website. The website is not yet open online. However, we know that many of you are interested to know what the website will be like. We thought you might appreciate a preview of what you can find when the website goes live. We also have updates on the timeline. First, you'll find the program and service ratings for all programs and services that we have rated so far. In addition, you'll be able to read detailed descriptions of the programs and services that will include information about implementation and training and details about the target populations and participants in the research that inform the ratings. In addition, we'll provide a detailed summary of the evidence about each program or service, including a summary of the findings for each of the outcome domains. The website will also include resources and other information such as the handbook, links to outside sites, and news as it comes available. Our two most immediate goals for the spring of 2019 are, one, to release the ratings of programs and services on the initial list for review, and two, to launch the Prevention Services Clearinghouse website. We know that many of you are eager to know when these activities will happen. ACF will be announcing the release of the ratings and the website launch through its social media accounts and the listservs on the gateway, and we plan to provide the field with regular updates. The Clearinghouse website will also include instructions about how to sign up for email updates once it is up and running so that you can keep abreast as things move forward. And we now conclude the formal presentation portion of the webinar, and we will turn it over to you for questions and answers.